talking about the deliberate self-harm or intentional mutilation of one's own body is again very important. Whenever these attempts are made, they can lead to the parasuicidal behavior, or they can lead to even a suicidal attempt in a lot of individuals. So again, the assessment is very important in such individuals. You have to assess the criteria whether he's suffering from a mild, moderate, or severe form of this kind of a self-mutilating or a deliberate self-harm behavior. These assessments are usually made on the detailed interviewing of that particular person, that the risk factors are also kept in mind. The previous history of deliberate self-harm is very important over here. Secondly, we have to focus on the life events of that person. What kind of relationships he had in the past, whether he had any conflicts with the parents or with the siblings or not. Then again, the child history is very important. The adolescent history is very important. The child history or adolescent history can reveal any kind of a sexual abuse or any kind of physical abuse or domestic violence if he has been facing such kind of a violent or an abusive behavior that can lead to such kind of a deliberate self-harm behavior. So all of these factors have to be kept in mind. And then again, the management of self-harm is very important over here. How can you manage a case of a self-harm? Starting from the assessment, starting from the history taking and the interviewing of the patient, then the interviewing of the relatives, the close family and friends. That is again very important when you're assessing such patients who are suffering from this kind of a deliberate self-harm behavior. So basically, in this section, we'd focus on the therapies or the treatment modalities that are present for the devising for such people who are suffering from this deliberate self-harm or self-mutilating behavior. The history would reveal the thought content. It would reveal the precursor events that led to this incident of deliberate self-harm, and that will give you basically clues towards the thought content and the thought form of that person. And further, what you can do is make a nice doctor-patient rapport with the person, and after that you can basically reveal the thoughts that he has about his life, about his own self, about his own body imaging, and the people who are surrounding him. There are a lot of delusions that he may or that she may be suffering from. So basically, if he has insight towards those signs, symptoms or not is again very important, because it is very important to discuss these kind of management plans or treatment modalities with the person. There are a lot of laws and legislations that are related to the mental health. So one should know the laws and legislations of their own country when they are dealing such cases of deliberate self-harm. The short-term managements are there. If you see that the person is not suffering from any kind of a personality disorder or any kind of a psychiatric illness, for example, it can be a depressive episode, it can be the mood affective disorder, schizophrenia or schizoaffective disorder, and it's just a single case, a single argument with a parent, a single argument with a partner can lead to such kind of a deliberate self-harm behavior, then only a short-term management will be given in such cases. And then moving on, we can also devise the long-term management with patients who are suffering from some sort of a psychiatric or a mental illness. Then a lot of research and prevention is being done for this kind of a behavior of deliberate self-harm. There are researchers, and these preventive behaviors basically have influenced the outcomes of these kind of a treatment modalities in a lot of individuals. So the management plans that are usually devised in such individuals, they can be the acute plans, as I've already emphasized. If he doesn't have a history of previous or repeated DSH, that is the deliberate self-harm, then only the acute management or then only a short-term management is devised. And the acute plan in the management, even in the organic disorders or in the psychiatric illnesses, they basically comprises of the taking the person out of an emergency state, making him stable is the acute plan that we are discussing over here. So the chronic plan would be the long-term management, the long-term pharmacotherapies that would take the person out of that depressive episode, or if he's suffering from some kind of a psychiatric illness, just to take him out of that psychiatric, mental, or if he's suffering from some sort of a physical illness is again very important over here. So, the deliberate self harm can range from the suicidal behavior or the parasuicidal behavior, or if he is having the deliberate self harm that is medically treated. Then again, there can be the hidden cases of deliberate self harm and the related mental health problems. So, a lot of research is being done when we talk about the suicides. A lot of research is being done into the specific risk factors of suicide, explaining the cross cultural differences in the suicidal rates, the implementation of the evidence based suicide prevention programs in a lot of countries. So these are the different kind of the researches that are being carried out on the suicidal behavior. So it's again going to modify the different kind of a deliberate self-harm behavior in a lot of individuals, depending upon the treatment modalities that has been devised in different individuals, depending upon the underlying pathology that is ranging from person to person. So, talking about the deliberate self-harm that is medically treated, it's basically a standardized assessment and treatment referral, and basically a lot of researches again have been carried out into the effectiveness of the treatments of the DSH patients, deliberate self-harm patients, and all of these standardized assessments and standardized treatments, they may prove fatal or they may prove as a failure in a lot of cases. So, talking about the hidden cases of the deliberate self harm, there is a lot of evidence based mental health promotion that is seen in a lot of cases. And the mental health promotions or the awareness is basically being created in the local population regarding the hidden cases of the deliberate self harm. When you see a patient, when you see a person who's having those wrist lines or he's having those aberrations on his wrist, that is basically indicating towards an adolescent or a teenager that is going through that deliberate self-harm behavior. So you have to take that patient or you have to take that person out of that situation, and that basically indicates that he or she needs help at that situation. So an acute management is devised in a lot of cases that basically comprises of if the patient is medically safe or stable. So if he has been suffered with the lacerations that have damaged the arteries of that individual, so you have to first of all focus on the physical state of that person. You have to be vigilant enough to get him out of that situation of that fluid loss and the blood loss that he's suffering from. And then you have to focus on the mental state or the psychiatric illnesses that he's suffering from. The risk assessment is very important over here. All of the risk factors ranging from the environmental and the cultural, the socio-economic background, the unemployment, the personality disorders if he's suffering from any mental and physical health issues. All of these have to be documented in the history taking, in the investigations that you have to carry out over here. So the long-term management would basically consist of the risk factors that need to be managed first of all, and then the comorbidities have to be managed as well. Comorbidities can be of a physical nature or they can be of a psychiatric nature as well. Over here, was this an impulsive self-harm? Because it's again going to basically indicate that he doesn't have any history of deliberate self-harm and it's just a single episode that was quite impulsive due to any argument at home with the siblings, with the parents, or with the partner. So was this a repeated self-harm? So it's basically these two questions are going to distinguish between these two groups who need a short-term management or who need a long-term management. So in this section, basically, we categorized the deliberate self-harm patients and how are we going to define the treatment modalities in each case. So that is the end of the section. Thank you for watching sqadia.com.